Artificial intelligence, aka AI, is literally everywhere. It is on our phones now, social media, anywhere you can think of, it is there, right? And I bet you didn't think AI was going to infiltrate the healthcare system, but it has. So let's talk about today how AI has integrated itself with companies in the healthcare system, pros and cons, and my personal experience with using AI every day. As a nurse practitioner, I was absolutely skeptical about AI being in healthcare. However, I have been using it every day in my practice with documentation, and it has changed my perspective a little bit. So today, let's have an honest conversation about AI in healthcare. What is it doing well? What kinks we need to still work out, and what should we be on the lookout for? Hey y'all, my name is Brianna. I am a nurse practitioner currently working remote in a gastroenterology setting. I have been a nurse practitioner for 5 years now. So crazy to say that. But I try to stay up on moving topics for healthcare in general. So not just educating you about certain topics with nurse practitioner, whether it's nurse practitioner school, my experience, or just topics that we need to stay in the know about. And I feel like AI in healthcare is one of those things. So let's get into how I use this every day, what my opinion was prior to using it, and now using it every day, how I feel, and overall what we're going to be seeing in the future. So let's start with how we feel when we hear AI in healthcare. I know people are thinking like iRobot, robots doing your surgery, robots replacing the doctors that you see, and I don't think that we're quite there yet. Now, we do have robotic machines that surgeons use for certain techniques in the surgery space. And I only know that because I've worked pre-op and PACU for quite a bit, and those things are already in place. Now, when I think AI in healthcare, for me, my experience is using it in documentation. So currently, we use a platform called Suki. Suki is a AI platform that records the conversation with you and your patient to help with documentation, basically. Prior to me using Suki, I was staying after maybe an hour or two after my shift was over to finish notes. I see 15 patients a day. Some notes are very simple. Other notes take a lot of detail, especially if they are symptom visits like abdominal pain or diarrhea or things that we have to do a lot of ordering tests on, etc. Also, it's hard to remember when you have back-to-back patients, all of the things that you have to chart for the one before. So Suki is a really good way to basically be hands-off. I don't like to have to type when I'm talking to my patients. I think it's rude, you know what I mean? But at some point we had to do it because we don't remember everything. So if you're constantly looking down, having to type and do all of that stuff and your patient is talking to you, are you really giving me your undivided attention? Are you paying attention to what I'm saying? Are you going to miss something? And I think you also have the absence of the relationship that you're trying to build with your patient, right? For me as a nurse or nurse practitioner, that is the one thing I like to bridge the gap on with my patients. I like for them to feel at home. I like for them to feel very comfortable when they are speaking to me about what is ailing them. And we don't have a lot of time. We have 30-minute visits. And so there's a lot to cover in those 30 minutes. If I'm constantly looking down at my computer, at my keyboard to type and re-ask you questions and ask you to repeat yourself, do you feel comfortable with me? Do you feel like I'm paying attention to you? So for that specifically is why I jumped on board with Suki. It's optional for us. Not everybody uses it in my department, but it was rolled out for multiple departments. Primary care uses it. I know cardiology uses it, gastroenterology, which I'm in, they use it, but not everybody uses it. Some people use the Dragon recording, but the Dragon recording doesn't record your conversation with the patient. It just records your responses to go in your notes. So that is my experience, and I'm going to elaborate a little bit more. So right now, AI looks a little bit different. The things that they are targeting is documentation support. We are losing a lot of providers due to burnout, And half of that has to do with charting and writing notes or staying after long hours to be able to complete and finish those notes and also bill for those patients. Prior authorization processing is just at an all-time high. Insurance is changing. It's a lot of things that they're not covering that we have to fight for our patients because they need it. And so those AI tools that help process that makes the process seamless and a little bit more faster, if you will. Also, patient triage chatbots. So I work remote, and the program that we uses a chatbot so that patients can schedule their appointments. So they're not waiting for anybody to call them and say, hey, we're going to make an appointment for here. Or once the referral is put in, the chatbot texts them and says, hey, you have a referral. When would you like to make your visit, and give them options? I think that that's a good way to mainstream and not have to go into the office or wait for somebody to call you. Other things are imaging analysis. I'm not really privy on how heavy this is used as far as x-rays are concerned and CT scans and all of that stuff, but I will get some information on that and then get back with you guys. Also, I think patient triage and then diagnostic support. So those are a few things that we're seeing in AI healthcare at this time. So let's talk about in depth what my experiences is on a day-to-day basis, and then what other things that we'll see. On top of providers and doctors having a choice to use Suki, patients also have a choice to decline. Let me be very clear with this too. We ask patients for consent every time we are on a patient visit. So the first thing I start with is introducing myself, asking them the chief complaint for the visit. We are verifying their patient identifiers, and then I go in to say, hey, I'm going to be using a recording AI device to be able to talk with you without interruptions that is going to record our conversation. Are you okay with that? I like for my patients to be in the know. This is what should be going on. And I say should because sometimes people do not do this. However, I ask consent for every one of my patients. If they decline, we getting in the trenches and we writing notes like we used to. But I would rather respect the patient's privacy and letting them know that this is what we're going to be using. And if you're not okay with that, then we don't have to use it and we can go from there. Now, let me tell you guys why I went from being skeptical about AI in healthcare to now being a believer in that. And it is because of the burnout crisis that we have with providers. We are, or have been, because I know I was one of them, have been spending at least 2 hours doing documentation for every 1 hour of patient care. That means sometimes staying over. That means sometimes working through lunch, or charts carrying over to the next day and having to bill and do all of those things. And so the crisis has become very serious. We are losing a lot of good providers and doctors because we're burnt out. And we needed tools to be able to maximize our time when it comes to documentation for the patients that we see and just being able to be efficient. When I started using Suki, I think I was already maybe 6 or 7 months into this role that I'm in right now before it was rolled out. A lot of people, again, were skeptical about it. Some people don't use it at all. There are times when it goes down. There are times when we have to pivot and put in tickets, but I feel like that's with everything that we use, whether that's equipment in the office or a machine that's not working x-ray wise, everything needs maintenance, right? So before that, again, I was working through lunch, trying to eat and chart at the same time, even though I work from home. I was staying maybe 1 hour, an hour and a half, or leaving work, picking up my child, doing dinner, all of that stuff, and then spending my time at night that I could be using to wind down or read or do whatever that it is to give back to me to chart on patients. When I started using Suki, I found that I was more present with my patients, so I'm able to just talk with them, not have to type, not have to clickety clack in the background, and I think that they appreciate that. So being more present, I was also able to have a work-life balance in some sense. I'm able to be done by 4:30, no pending charts, everybody is charged for. I can go pick up my kid on time, do all of the dinner and play with him and prep, see my husband and all that stuff, and not have to worry about, oh, I have this chart in the background pending. I have these charts that I need to finish, or staying up until 10 o'clock, 10:30 when I'm not even getting paid to do that because we are salary. So that is my personal experience and why my perspective has changed on just being more efficient and having quality documentation. I will say there has been times where I still read over the notes. So I'm still taking time to read over what Suki has captured for me, because sometimes it's not the way that I would say things. It's not what I would explain it as. But also I want to add my own touch to it because I'm still the provider. So I'm still adding labs to my notes. I'm still adding the imaging that we've talked about or discussed, or past imaging that will help everybody else who reads the note after me to have a very clear visual of the patient and what they need. So I'm still going in to correct things, change things, make sure that it flows well, and creating addendums for if I see the patient again for a follow-up or have a phone call. So it's not me completely giving my notes to Suki 100%. I'm still very hands-on, but I have become a more effective provider because of it. AI is also being used in many other different ways. It's being used to catch or flag drug interactions when people are putting in orders for medication, maybe critical labs, using it to be a diagnostic, education, or decision-making process for certain situations. I've seen it used in underserved communities that maybe only have a urgent care or one emergency room to however big the population is, or a small town. So they're using that as a triage situation. So maybe you get triaged before you come, and how long the wait is going to be before you leave your home. It's helping radiologists to catch things a little bit earlier. So it's being used in different ways. And I think that, again, this is making things a little bit more efficient rather than replacing the people who is doing the job. I know that a lot of people have been replaced by technology, so I'm not taking that away at all. I am not blind or ignoring the fact we have self-checkout, and I'll leave it at that. But as far as healthcare is concerned, I think that it is helping us to do our job better so that we can serve our patients better in a capacity to where they get our 100% undivided attention. However, I am not just here to sell you on AI in healthcare. That's not my job. I'm not getting paid for that, because there are still conversations in the background that need to be had. One of those is how AI is trained in diverse populations of people. For example, if the AI tool that is being used is not being trained in different diverse populations, for example, African Americans, they are not going to be very accurate things for African Americans. We already know for Black and brown populations, we have a healthcare disparity. We don't always get the care that we should. We are not always treated as our counterparts. And if AI is not being trained in this diverse population, I fear that we're going to continue to have a gap in those spaces. And that is not something that I want. So I would love to continue having a conversation on how AI is being trained to pinpoint and identify patients of color. There is backed research that says that AI diagnostic tools are worse performing for Black people than it is for white people. Obviously, even with humans and not technology, this was already an issue. So this conversation needs to be at the heart of any AI adaptation that we're going to be putting in healthcare, because it's going to create a bigger problem, and we cannot have that. The second conversation that we need to be having is liability with AI, right? If we are using diagnostic tools for labs, critical labs, drug interaction, documentation, and somebody gets it wrong, something is missed, and a patient is harmed, who is liable for that? Is it the technology? Is it the provider? How do we mitigate patient safety issues when we don't know who is going to be liable for it? And I think that that's a really big conversation, because we need to know who is responsible. Is it the hospital that implemented the tool and trained us on it, wanted us to use it? Right now, the legal framework is still being built around that. And I think that that's one of the most important things, because in healthcare, you can be tried for a case up until 10 years. So if you used AI at some point, are you going to remember that you used it? Are you going to remember what you wrote? These are really big conversations that are still being had in the background, and they need to continue because we need a framework and a black and white thing that says this is what's going to happen should this happen. The third part of this is, of course, consent, which we already talked about. Now, there are certain tools, and I've seen a couple of conversations on threads, etc., about people not being very fond of AI and how they don't like it and things like that. I really feel like you should be telling the patient that the tool is being used. If they don't want to use it, they don't have to. We don't have to use that. But it needs to be a consent part because this is also their protected health information. So we shouldn't be just turning on machines and saying, hey, I'm going to record you without any consent. Give the patient the choice. It is their, that's autonomy, basically. So we can't go into these things just saying, oh, I'm going to use it because they told us we can use it. No, did the patient tell you that you can use it? So if that's not the case, then we need to wrap that up and be transparent and give informed or have the patient to give us informed consent so that we can all feel comfortable. Because what this does, if you don't do it, is create a untrusting relationship. You're supposed to be my provider, my doctor, my nurse practitioner, but you're going behind my back and using something that I didn't give you permission to use. And it just doesn't create a trusting relationship, which you should have with your healthcare provider. And the fourth, but last but not least thing is that making sure that providers, doctors, nurses, whoever it is, don't rely heavily on these tools. AI is used or should be used to help us to be efficient, not relied on heavily for all the knowledge we went to school for, right? I didn't go to school for years upon years upon years to have a computer tell me what to do. Computer cannot tell me about clinical judgment. It can give me research articles. It can give me things that have been done in the past, but my clinical judgment is always going to be prime here. So AI is not replacing that, not for me at least. So that's not something that I pride myself in. I like to still use my clinical judgment. And right now I'm only using AI for documentation. So that I feel like needs to be talked about on the provider end, because it could seem, oh, we're just allowing people to use whatever the case may be, and then now we're relying on it and we're not using the tool up here that needs to be worked every single day for it not to become dormant. So don't rely too much on AI if you are a provider who is using it. So where do I land in all of this? I will say that AI is not the enemy of healthcare, and it's also not the savior either. I think with everything that we put in healthcare technology-wise, it's about the person being thoughtfully and responsible using that tool. I think that's how it can be effective. I know by using this every day how much of a better provider I have become with patient interactions and commitment of time. I have also been able to get my time back. I've been more efficient with documentation, not less. So for me, that is a win. What I do know is that we cannot build the future of healthcare technology without keeping all of us in mind. And that is every population. So if we're building tools that are being designed to separate us, that's not the tool that we want in healthcare. We don't want tools that are going to be against or already separating at baseline Black people, African American people, brown people, people of color. We don't want that kind of thing. We don't want bias. We don't want consent gaps. We don't want liability questions. So those are things that need to be continued to be worked on. I think providers will thrive if they use this very intentionally and responsibly, and they use this with the full knowledge of how they're going to be integrating this in their practice. They are using these tools very critically, very intentionally, not blindly at all, and not fearfully. And I think we should also go ahead and take it a step further to empower our patients, to allow them to ask, how is AI being used in my care? How and do I have a choice? And yes, they do. And empower them in that choice, because we definitely always want for our patients to be autonomous. So I want to end this video by asking you, where do you stand on this? How do you feel about AI being used in healthcare? Do you feel like this is something efficient that you could do? Do you feel like you probably won't be one of the people who adopts this in their practice? Let me know in the comments. I really want to continue to have an honest conversation about AI in healthcare healthcare and what that looks like for us. If you're a healthcare provider and you're watching, tell me if your practice has already adapted AI. How do you feel about it? Did you have a choice about using it? How your patients feel about it? And we'll continue to have this conversation because I feel like open communication for these kinds of things is always necessary. As always, thank you guys so much for watching and having the open conversations with me as we tackle things that help it happen in healthcare. If you happen to catch the short version of this on TikTok or Instagram or on YouTube Shorts, welcome. I'm glad you're here to have the conversation. There's a lot more where this came from, so make sure you're subscribed, you like and share with a friend who might find this conversation interesting or could use it and have a bigger talk with it. My name is Bree Lachey. Thank you guys for watching. Bye.